So hi, Kelly.
Hello.
Hi. You want to start by just telling me you're Kelly Hopton?
Yes.
And how old are you?
I'm 31.
31. And you're 12 weeks from surgery.
That's right.
And you've had a 2-level revision posterior-lumbar interbody fusion.
That's right.
When was it?
March.
March 2011.
That's
okay.
right.
And it's unrecognizable, isn't it, really, in terms of who you are?
It's a miracle, a definite miracle. Yeah, I wasn't Kelly before, and I'm Kelly now again.
Okay. So tell me a story. Take it from the beginning. Tell me about your back.
Right. I wasn't doing anything particular. I just literally put my daughter down one day and felt excruciating pain. Following that, 3.5 years of in and out of hospitals and begging surgeons to help me, begging doctors to help me, in a horrendous pain, in wheelchairs, on crutches, with no quality of life at all, really. And then I heard about Mr. Krishna via the newspapers, and we came to see him, and within 20 minutes of seeing him, he said, "Yep, I can fix you." So I was lucky enough after that appointment to have my surgery about a month afterwards, and I went into the Nuffield in a wheelchair, and 9 days afterwards I walked out and feel like a new woman.
Okay. And we've also had a little miracle in terms of your waterwork. So tell us a story about that.
That's right. I lost the use of my bladder just over 3 years ago, and I was self-catheterizing, and I had a suprapubic catheter fitted, and I was just about to go for a Mitrofanoff operation, which basically is non-reversible. And luckily I decided just to wait a little longer for that. I wasn't ready for that. Had the surgery with Mr. Krishna, and unbelievably, 7 days after the operation, my bladder is working now, absolutely perfectly, no problems, to everyone's surprise.
And what for me is a miracle there is that there was no actual pressure on the nerves supplying your bladder.
Mm-hmm.
So it's just the inflammatory material from the disc that was causing the bladder problem,
That's right.
I think. And that's why, you've done well.
Yeah, but it's 2 miracles, the bladder and the back.
And the back. And you've also been on morphine for a long time. So share the story about how much morphine you've been on and what it's like to come off it.
My heaviest medicated time, I was on 50 tablets a day and 150 mils of Oromorph. Times got so bad, I was in that much agony that I almost didn't care, and I just grabbed the bottle of Oromorph, liquid morphine, and I just drink and drink and drink, just to try and desperately just get some relief from the pain. Unfortunately, following that, I got addicted to it and had a very bad time with the morphine and lots of different other medication that I was on, the tramadol and things like that. And again, another miracle, after my surgery, within a week, Mr. Krishna got me off all medication, all the morphine. I was literally on just paracetamol and diclofenac, which was another miracle.
And now you've gone from 50 tablets a day to none at all?
To none. Absolutely none.
Okay. And let's talk about your job. You work as a teacher.
That's right, primary school teacher.
And you really love the job.
Adore my job.
Okay. And tell us a story about what's been happening about your job. And it was at risk recently.
My job was very much at risk, yeah, because I had, like I say, the 3.5 years, 4 years nearly of pain, back pain. I had a lot of time off work. Therefore, my job was in jeopardy because of the amount of time I had off work. Mr. Krishna, again, was fantastic, and he wrote a letter to the school for me when they were considering keeping my job open for me or not. And with his help, Mr. Krishna's help, my job is now still mine. He assured the school that by August I'm going to be fit as a fiddle. So with the weight of that letter from Mr. Krishna, I've been able to keep my job as well, which is incredibly important to me.
And tell me about what you can do now that you couldn't do before. So how far could you walk before the surgery, for example?
Before the surgery, I was in a wheelchair. I couldn't walk. I was bedridden. I had to have a catheter in because my bladder, I couldn't get to the toilet even though I live in a bungalow. I had no quality of life. I have a young daughter, and the guilt of not being able to look after her was immense, and the pressure on my husband was immense. Just a very, very dark time.
And how far can you walk now?
As far as you want me to.
Okay. Okay. And of course, we haven't seen you laugh before surgery at all.
No, it was always tears before.
Always
tears.
Yes.
Always with pain in my eyes and depression.
And you were depressed for how long?
4 years. The whole time that I was useless. That I was just in agony constantly. Pain. Awful pain.
Yeah. And you have a wonderful family and very supportive family.
Incredible family.
Yes. And your husband's here, and I wanted to catch him and say hello. So, you want to pull up a chair, sir? Let's have a chat with you about, what it's like to live with somebody who has back pain. So, what's your name?
My name's Jason Hopton.
Jason. Okay.
Hello there.
So, Jason, tell us from your perspective what it was like being with Kelly and the problems she had.
It was so hard because Kelly wanted to do things and she physically couldn't do them, like just looking after her daughter, just picking up and cuddling her. She couldn't do anything of that, and it really, really affected Kelly mentally as well as like the pain. And since this operation, it's like, I do still pinch myself every morning myself because it is unbelievable how Kelly is now. She just gets up, she does everything normal a normal person would be doing. She loves Olivia, she plays with Olivia perfect, and it is just a miracle for me. Unbelievable.
Well, it's been a pleasure for me to have looked after you, Kelly, and got to know your family.
Thank you. You are a miracle worker. You are God. You are.
Do you know the difference between God and an orthopedic surgeon? God knows he's not an orthopedic surgeon. Just kidding. Okay. Thank you very much for coming.
Thank you very much.
Okay.